Hey, what's up guys? I want to go over an assessment that I use when a new client with low back pain comes to see me. And this is an assessment that I learned from Dr. Stuart McGill. And the point of this assessment is to identify postures, motions, and loads that may trigger a person's back pain or maybe take away a person's back pain. So, to explain, when a new client comes to see me, I'll have them in a standing position, relax, and from here I'll just take them through an anterior pelvic tilt where we're going into an extension-based position and a posterior pelvic tilt where we're going into a flexion-based position. Now, upon moving through the anterior and posterior pelvic tilt, if that triggers symptoms, whether it's in the anterior pelvic tilt or posterior pelvic tilt, we know that that posture triggers their back pain, which could be extension or flexion. But it's important to understand that because it gives us insight to what could be going on with their back pain. Because if they're going into that extension posture and that gets pain, we know that they probably have some extension-based back issues, or if they go into the posterior pelvic tilt and they have back pain, we know they have some flexion-based back issues. Now, at the same time, a person with back issues, their pain may not trigger by going through that motion. But we can play around with things by adding loading. So, the next step would be, I would have a client hold a weight. And I have a 20-pound kettlebell here. We'll hold it by the sides, and then we'll go through those same motions. So we'll go into an anterior pelvic tilt, and then we'll go into a posterior pelvic tilt, but now with the added weight. So what the added weight is doing is it's adding a compressive load to the spine. So by adding a compressive load to the spine, there could be an increase in the size of the disc bulge, which could put pressure maybe on a nerve root if they get symptoms with the added load. And on the flip side though, what could happen as well is when we hold the weight, it can actually take away a person's pain too, because it can create a stabilization effect, similar to how a key may fit into a lock. Everything may just kind of lock in together, and the added weight is providing stability if someone maybe has some instability in the low back. So, what that tells us is that the added load, whether they get symptoms or not, it gives us information about what may provoke their back pain or what may take away their back pain. So, I'll give you guys an example. If someone has pain in a posterior pelvic tilt or an anterior pelvic tilt, when we go through that flexion extension, with the weight though, we need to be very careful with maybe how we're programming an exercise, maybe such as a squat or a back squat. On the flip side though, maybe someone has pain with just body weight flexion and extension, but the added weight, when they add it in and then they go through that motion, it takes away their pain. We know that they have some instability perhaps, and we want to work on some core stabilization, so focusing on some spinal stability exercises to help build stability in the low back. So, whole point of the assessment is to help educate the client about the different postures, motions, and loads that may trigger their back pain or take away back pain. And as for the trainer myself, it also gives me information about how we should go about programming exercises for the client that doesn't trigger their back pain, and we're building up a capacity that allows them to get to more advanced exercises and takes away their symptoms. So, just a little assessment that I wanted to share with you guys. And if you have any questions or comments, be sure to leave them below and I'll be happy to answer them. Okay guys, hope you guys are all doing well. Take care and all the best.